So thank you, boss. Um, all right, so let's get back into constant news cycles and what that does to us. The modern media environment can keep people in a constant state of alert. Now, I don't know everybody here on the call, but I can imagine that most of us grew up or at least experienced a good chunk of life when this wasn't a thing. So for some of us, this is still a new thing. For some of us, maybe this has been our experience for most of our lives. But for a majority of people, still being having access to a 24/7 media saturation situation where not only the news is going 24/7, but it shows up on the device that we probably spend the most time with. That is a new thing that our nervous systems have not evolved to deal with yet. And so we're all figuring that together. Breaking news alerts happen all the time. I remember the first breaking news alert that I got that was confusing for me. It was almost 10 years ago. And I'll never forget, before breaking news alerts happened when something really big in the world was taking place, something that would give us all pause. And I remember getting an alert on my phone back when I checked my phone when I got alerts for the news. And it said something about Octomom. And I thought, why is this breaking news? No offense to Octomom, have nothing against her. But our systems are primed in a different way that they weren't primed for before, as far as how we receive our news. But on top of that, it is amplified via social media. So distressing stories spread very quickly, and a lot of times we watch them happening in real time. I'll never forget in 2020 when a lot of the marches were happening over George Floyd. Every night, and I'm not saying this is healthy, but this is what I did. Every night before I went to bed, I would just open up TikTok and I would see people in the marches live. And I was experiencing it with them in a very different way, obviously. But I was going along, my nervous system was going along for parts of that journey. Um, Negative headlines, things such as crisis, conflict, harm, and uncertainty are often emphasized because they capture the most attention. And that's the way the news economy works. And we have repeated exposure. So if you see something in one thing, you're going to see it somewhere else. If you saw something on TV, you're going to hear about it on the radio. And then when you open up your phone to see what your cousins are doing on whatever your preferred platform is, you're likely going to see it there too. So psychologists have described rising news-related stress as headline stress, meaning anxiety sparked by relentless negative news. Now, this has impacts on us, both on our minds and also on our bodies. And so, physical arousal, it can show up with increased physiological arousal. And things like elevated heart rate or stress hormone activation can take place just from reading a headline, even if you don't read the headline or read what the headline's about. The psychological arousal, things can bring about anxiety and fear, rumination or repeated worrying, a sense of helplessness, and difficulty calming down after exposure. And people are going to experience that in different levels of severity. Some people, maybe it doesn't bother them. Some people, it can impact them quite a bit. Me, I find myself personally, sometimes things will impact me quite a bit, and sometimes they don't. And I think that's true for everybody. News outlets often focus on crisis and conflict because those stories hold attention, and that, in a sense, could make them more money. However, prolonged exposure to alarming content can wear on mental health. The body may respond to alarming news as if there is an immediate threat, even when the event is distant or outside their direct control. So, this is a common thing that people experience. Um, and maybe you're aware of that phrase doom scrolling. Show of hands, or maybe in the chat, or just say it out loud. Is anybody familiar with that term? Or maybe you're guilty of it, like I am? Yeah, yeah, okay. I'm not alone. I got at least one people or one person. So doom scrolling, if you're unaware of that term, is the habit of repeatedly scrolling through distressing news, even when it's increasing your stress. And it can create this cycle. And that's why doom scrolling can be a very negative thing for many people because you see a distressing headline. And then you want to, it's a natural response, you want more information about that thing that is going on. When we have more information about something going on, we feel better prepared to deal with it, defend against it, form an opinion about it, whatever, right? And so that additional information increases anxiety, fear, or frustration. And so we continue to check the news more, and that cycle just continues and it creates more stress. Now, the American Psychological Association found that many Americans feel overwhelmed by the number of crises in the news. Now, that stat came from 2022, and I don't know if you've seen this meme. It's one of my favorite memes, but it's a video of this woman talking to another woman, and you could tell that they're sharing something really juicy, and the other woman is just like, "Oh my gosh, I can't believe that's happening." You can see it on their face. You can't really hear what they're saying, and the caption on the meme says, now talking to 2019, right? Um, we feel like things are chaotic in our world, and things are chaotic in our world. So issues like the future of the nation and the economy are significant sources of stress for many adults. And that is not a partisan issue. It doesn't matter what side you're on. If you hold yourself to some type of binary, that is something that everybody is experiencing. More information, though, doesn't always create more control, and sometimes it creates more activation. So it can show up in a lot of different ways. Chronic news related stress can show up with emotional signals like anxiety spikes, irritability, anger, sadness, helplessness, dread before checking the news. Physical symptoms could be things such as racing heartbeat, muscle tension, headaches, fatigue, sleep disruption. Cognitive effects may include rumination, difficulty focus, trouble seeing positives. Everything just seems like everything's falling apart. Decision fatigue, replaying what if scenarios. Behavioral patterns may include avoiding news completely, or it could be the opposite of compulsively checking the news. That's something I know I do that I've learned about myself. Checking news before bed, which isn't always a good idea, or feeling unable to disengage. Um, yeah, and I see that in the chat, Joyce. It's mindless activity with potentially less than positive consequences. Algorithms feed into those topics being viewed more in the media feed, making the process worse. Yes, absolutely, absolutely. And they're rewarded for doing such, right? And so just being mindful of that can be useful, because the goal is to stay informed. As I mentioned before, people such as us that do the things such as we do, we need to be informed. We need to understand what's going on. We need to be able to break certain things down for people in our community or the people that we serve in our communities. So the goal is to stay informed without being overwhelmed, which isn't always easy. And sometimes it does take a strategic approach, and that's what we'll talk about. Um, Policy news hits differently for us too, because a lot of people, they might hear something and they might go, "Oh man, that's terrible." But when we hear it, we actually know what it means. A good example is, I think this happened maybe 2 months ago. Remember where when all of the SAMHSA grants just kind of disappeared and nobody was like, nobody even really understood why. And then within about 24 hours, all of those grants, or most of those grants, I believe, were reinstated with really no real explanation. I was messed up that whole day, and I've had several SAMHSA grants but I haven't had a SAMHSA grant in a while, and that messed me up the whole day. And I remember reaching out to other friends that I knew and coworkers and partners that I knew that had SAMHSA grants or had worked in SAMHSA grants just to check on them. And we were all kind of discombobulated, like, what is going on? We don't even know why it's happening or how it's happening, but it's just happening, right? So these things hit differently for us if we're in public health or the social service sector. It can feel personal because it directly affects our work. Even if it doesn't directly affect our work, it might indirectly affect our work or the people that we care about serving. So policy related news, it's always going to rise concerns about funding, staffing and job stability, a lot of times even our own jobs, community services, access to prevention, treatment, support, vulnerable populations, long-term public health goals that maybe we've spent our whole lives working on, or most of our lives, or much of our lives, and whether communities will have what they need. Many of us enter this field because we care about people. And that is an emotional investment. And that's part of our strength, but it also can make negative news harder for us to carry. It weighs more for us than it may for other people. And public health and social service professionals are not only watching policy change, we're often responsible for helping communities respond to it. So for many of us, there's like a double burden that comes with particular types of news, especially when we don't understand all the details. Like we hear something may be coming. Something I think about, it's going to be quite a bit of time until a lot of changes happen in our Medicaid and Medicare system. However, when those changes happen, the best estimates say that up to 7 or 8 million people might go without coverage. I think about that all the time. Even though it's years until it's going to happen, that's something extra, that's heavy, that's weighing on my psyche. And as it should be. Funding uncertainty, moral distress, and community concern are all peaked when these things happen. And these policy shifts are always going to create stress in us um, because it introduces an uncertainty in work that was already demanding in the first place. If none of that news came down the feed, you would have already been stressed at your job because we do stressful things. Um, and so I'm not even going to go into all of these stressors because I think you guys are feeling me on this one. Um, but I think it is important to acknowledge that it is common to feel frustration, sadness, anger, fear for our communities, a sense of helplessness and emotional exhaustion. That is a normal thing. And I would make the case that circumstances that we all went through make it even land harder because when we went through that COVID era, those of you who remember that, I'm sure we all do, many of us already had high workloads and burnout, right? But then we go into the pandemic and we are all experiencing that together. And so um, before the pandemic, if you had high workloads, if you were more prone to burnout, which people in our industry are more prone to burnout, you already had an increased likelihood of symptoms of depression, anxiety, and PTSD. That doesn't mean you will have it. It just means that the likelihood is higher. Um, but then the pandemic happened, and then political polarization became even more inflamed. Public criticism became more public. Maybe things that people normally said under their breath or just to trusted people, they would say out loud in increasingly more public ways in public forums. And then maybe some of you experience this, and the stats say that that is the case, that bullying or threats towards public health workers were on the increase, and some of you received those. I myself have a few stories. So many of us weren't starting from neutral. You were carrying stress already. Um, and the stat here is that over half of public health workers reported symptoms of at least one mental health condition, such as depression, anxiety, or PTSD, and nearly 1 in 4 reported facing bullying or threats on the job during the pandemic era in that particular sector. So that's the problem. Um, we're all aware of the problem. But I don't like to just talk about problems. I like to talk about solutions. So what are some things that we can do about it? So I've got a couple of things. Again, I saw that we had Dr. Trinidad, so if there's anything that you wanted to add or even pull apart, please feel free to do so. But I did want to offer some
Thank you.
common positive responses. Oh, did you have something now?
No, I said thank you. I
Oh,
will.
thank you. I know you will. That's what I like about you. All right. So one strategy is mindfulness. I'm not going to spend a lot of time talking about mindfulness. A simple Google search will start you on that journey. Um, One practice that is very accessible is the 5 4 3 2 1 technique. If you've heard of that before, very easy to do. You can do it pretty much anywhere. As a matter of fact, I'm going to ask that you do it now, and it's really this simple. You name 5 things that you can see. Then you talk about 4 things that you physically feel in that moment. Three things that you hear, 2 things that you smell, and 1 thing that you taste. Now, I'll defer to Dr. Trinidad on this, but my understanding is that when we're having particular negative responses in our bodies, that our brain may be working a certain way. And so doing this gets your brain to work in a different way and reinforces the way you want your brain to operate in that moment versus how your nervous system might be being hijacked in that moment. Um, Even a brief pause, a few breaths, 1 minute of a grounding exercise can help reset your body after stressful news exposure. Did you have anything to add to that, Doctor?
Yeah, one of the things I was thinking about that we don't address a lot is understanding the function of the brain.
Mm,
The brain is the most important and the most fantastic organ that we have. Because the brain gives us a lot of signals. The brain let us know where we're going into a dangerous situation, and being able to really focus on those signals is important. Let me
mm,
give you an example. I don't want to take too much time, but let me give you an example. Back in in the early 70s, I was working for Sangre de Cristo Community Mental Health Center in Santa Fe. And I had this young man brought in by his mom uh, to seek mental health services. And apparently, he had been on antipsychotic medication at one time. So I saw him and I went to my supervisor and I said, I have a gut feeling about this young man. And the supervisor told me, that's not scientific. Don't even bother listening to your gut feeling. I went, okay. So then several decades later, a research came out with gut feeling is a signal from your brain telling you you're in danger. Something's going on. Pay attention. And I said, boy, I wish I knew where that supervisor was right now so I could send him this article. So again, we cannot dismiss the functioning of our brain because we exist because of our brain's normal functioning. So when we're talking about stress, when we're talking about these uh, um, issues, where does anxiety come from? Where when we get nervous, when we're not able to sleep, and if we spend all day on our cell phone, tracking all of these issues that are being blasted 24/7, we have to look at, and that practice that you went through, that grounding is fantastic. Looking at how we can get, ourselves back into a normal place. How do we need to separate from those type of information or those type of systems
mm,
that make us feel the way we do? And we have to be aware of our feelings, how, our mood, our behaviors. We have to be aware of that because if we don't, then we're going to sink further and further down. That's all I'm going to say about this right now. I
Thank
hope
you
that
so much.
helps.
Thank you so much. Actually, I'm really excited because I didn't know I was going to have like experts when I gave this presentation. So thank you so much. This really makes the presentation, and I appreciate your contribution.
Thank you.
Another strategy that I will throw out there are just practical boundaries about how you engage with the news. This is something that I've had to learn how to do. A few times I've had to reach out to my boss and say, hey, I actually need to do this instead because I'm noticing I'm starting to do this. And I know what happens when I start to do this. And like Dr. Trinidad said, it's nobody else is going to take care of your brain, right? You have to see when your brain is giving you signals that something's going on and take action. And this is one of those ways. Just putting boundaries around the way you engage with the news. So checking at specific times and only choosing to check at those times. So like I mentioned before, I noticed when I start to spiral, I'll start checking the news and it could be like every 5 minutes, like something's going to change. And it's like, okay, no, my body's telling me something. I shouldn't be this way. I need to actually do something else. Turning off unnecessary breaking news alerts. If you have not done this, I highly recommend it. I promise you, if something really big happens, it will still get to you. I've had my breaking news alerts turned off for a very long, probably like 8 years, and I've never missed anything. Using a timer to limit scrolling. Um, Creating a no news zone, like for instance, during meals or family time, is there a specific time where maybe you can set your phone aside or, you don't open up certain websites if you're on your computer? Take screen-free breaks during the day. Now, whether it's the news or not, these are very healthy things to do for yourself. Notice which source, I think this is really important too, noticing which source leaves people informed versus overwhelmed. There are definitely some news sources that are more focused on getting a reaction versus just giving out the information and leaving you wherever you are. Some might lead you into a reaction if you pay attention. Um, so just making sure you have boundaries that will help your nervous system reset in a way that works for you. Some of those may work for you, some of those may not work for you. Um, Also, and I kind of hinted at this earlier, just choosing reliable sources. I'm not the guy to talk about which one's reliable or not reliable. That's a journey we all have to navigate ourselves. There are resources out there, if you Google it, that'll help you understand how different outlets might respond to the same thing, and it'll allow you to compare all of the various headlines on the same event and to see how they lean. And you can make your choices based on that. But it is good to be mindful of where you're getting your information from. When a headline stays with you, as like I mentioned before, we need to know what's going on in the news, right? Um, and if it's impacting you a certain way, there are also other ways that you can deal with that. Just writing it down, naming the feeling connected to it, separating your facts from fears, identifying what's within your direct control, and choosing one grounded next step, which I have some suggestions. Journaling or writing down a troubling headline can create distance from the emotional reaction and reduce rumination. How's that land for you, Dr. Trinidad? Anything you'd want to add to that?
Well, yeah, I was thinking, when we find ourselves caught up in repetitive patterns of behaviors, we really have to, take a step back and start really focusing on our cognition. What is it that is triggering us to do this repetitive, unhealthy behavior? What am I gaining from it? Why do I keep on, putting on the news if I know that it's going to, trigger my anxiety or not allow me to sleep at night or whatever? We have to be very cognitive of that and ask ourselves, why are we doing this to ourselves? And then do a plan for ourselves. What kind of plan? Well, as you said, you could start writing down, why is this important to me, and why do I keep on going back, to watching the news or hearing the news or whatever, and then set a schedule for yourself. You know, when you know that you're going to get triggered, go, no, I'm going to do this instead of this. I'm
Mhm.
going to do this instead of that. And then follow that schedule so that you could reduce the time. And hopefully over time, you'll be able to move on to a healthier situation than keep on repeating the dysfunctional behavior over and over again, because that is what tends to harm a lot of people emotionally. Yes, we do need the news, but we don't need to be hooked into it 24/7.
Thank you. I love what you said about asking why. That's something I definitely can improve on. I also want to lift up what Valeria said in the chat. She said, I find that reading news is less anxiety provoking than listening to the news or radio. I think it has to do with how I take information that doesn't activate me too much emotionally. So yeah, that's good. Find what works for you. There are different mediums that might work for you. Some might produce more anxiety than others. Another one is not doing it alone. If you are now, I think I could have done a better job of designing the slide because I think there are ways of processing news with community that might not be helpful, but most of them are, I would believe. Um, Social support is a powerful buffer against stress in general, whether it's news related or anything else. So if you're going through something as you're experiencing the news, the key is don't do that alone. Talk with trusted colleagues or other people in your life. uh, Debriefing stressful policy changes. I know one thing I did in a prior situation was every time a big impactful news thing came out, we would just have a very informal meeting where people could say what they wanted to say or not say what they wanted to say about that particular thing, just so we had the space to air out how we felt. We didn't have to hold it in. So if you're in a position where you can create those opportunities for others, that can not only be useful for you, but for other people as well. And so asking how others are coping. So you're not just focused on how you're feeling in the moment, but just experiencing it as a community. Normalizing emotional reactions. Maybe you're in contexts where people are just like, hey man, you just need to toughen up. Well, that might not be the time or the place. Creating team check-ins or peer support routines. Um, and so, however that makes sense in your communities or the communities that you create around you, the key thing is that you don't have to carry the stress alone. Um, and likely every time I've ever done that personally, I always found that I wasn't the only one feeling what I was feeling. And that in itself can bring a lot of relief. When more support is needed, and this happens, hey, I think at least us, people, those of us that work in this industry, we should be long past the point where we stigmatize this, right? This is a very common thing. 1 in 5 people have a mental health disorder or struggle, right? Um, so if you feel that you might be crossing over into a struggle that you might need outside assistance with, just acknowledging it, it's not uncommon, right? It's a common thing that happens. And for many people, news could be one of those triggers for those people. Um, so it's good to know basic signs for yourself, or maybe you observe them in others. Extreme anxiety, hopelessness, persistent sleep disruption, withdrawal from others, difficulty functioning, feeling emotionally overwhelmed, signs that someone may need, that they may be unsafe or in crisis. Um, Supportive responses may include checking in privately and compassionately, encouraging the person to connect with a counselor, employee assistance program, health care provider, crisis support, reducing stigma around asking for help or even acknowledging that one may need help, creating a workplace culture where stress can be discussed before it becomes a crisis. So if you see things coming on, creating a place where it's just safe to talk about that. Now, sometimes we have control over that, sometimes we don't. But if you do, go ahead and be that person. Peer support is valuable, and professional support may be needed when stress becomes unmanageable. Dr. Trinidad, anything you want to add to that?
Yeah, one of the things that for a lot of us who work in this profession, uh, and for people who don't, that we have to stay educated and we have to educate the community, and picking up these signs. Okay, I've had several cases where, and I live in Taos, where people have um, gone in the other direction and have ended their lives. And when I discuss the situation with some of my colleagues, then they share with me, well, prior to that person, taking their lives, this is what was happening to them. And I would just look at the person and I go, and no one picked up on that. When you have a person who's extremely stressed, regardless of what it is, and you see them that they're isolating themselves, that they're not communicating the way they usually are, that they're sleeping more or less. Any of those type of behavioral changes we have to be aware of, and we have to educate ourselves and educate our community members, because you want to prevent from the individual going to the extreme, letting them understand that there are options, that you're there, to listen to them, to hear them. And we have to also work on our own biases, and our stigma related to people and their issues in our community, so that we could be able to help them and they feel comfortable seeking help as well. And these, we don't think about it, but a lot of these news, either on the radio or the TV or through our cell phones, they do trigger a lot of reactions to us, because a lot of us have been traumatized in the past. And so how do we then, get to a healthier place so that we can then move forward and model to the community, how we need to move into a healthier place.
Thank you. Thank you so
Yeah,
much.
you're welcome.
Also, before I move on, I want to uplift a couple of things in the chat. One, someone who happens to be my favorite triathlete, also mentioned that they just stick to watching local news if anything is going on in New Mexico, but they also read the Santa Fe New Mexican and the Albuquerque Journal, and for U.S. world news, they watch another show. And I'll just let you read that, even though I feel the same way, but I don't want to come off one way or another. But yes, yes. And then also, Valeria says checking with your team is so essential. And yes, absolutely. Yes, yes, absolutely. Okay, and this is my final strategy, I believe. Yeah, yeah, yeah. And there's a whole lot going on in the slide, but just talking about resilience, I think, is always important. A lot of times, like I mentioned before, we talk about the problem and what negative things can be done, and we don't talk about like the positive things and the positive things that can be done. And one of those things is that you can build resiliency. And something I used to always say to myself to kind of psych myself up, regardless of what I was dealing with, whether it was like mental health or a physical thing, it's like I'm less worried about what that thing's going to do to me, and that thing should be worried about what I'm going to do to it. And what I mean by that is, there's always something that we can contribute, and one of those things is building up your own resiliency. And unfortunately, we find ourselves in times where probably all of us need to be more resilient than maybe we once needed to be before. So a key thing, and this is one that I always have to do, focusing on what's within my direct control. Reframing challenges without minimizing them too. Celebrating small wins. Whatever you're bemoaning, there are probably a bunch of other things you can celebrate in that moment, right? Practicing self-compassion. Some of you, especially those of us who were raised in maybe more masculinized situations, you often aren't awarded that ability to even feel something, or to feel something negative, or to have emotions or have some type of reaction to something going on to you. So just practicing self-compassion can go a long way. But that's true for everybody. Maintaining sleep, movement, nutrition, and rest, that's going to help you no matter what. Staying connected to supportive people, key emphasis on supportive, and reconnecting with mission, values, and purpose. That's so huge for me. Just reminding myself like why I wake up in bed and do the things I do, and why I've devoted my life to certain things. That can be huge for me. Um, Binding anxiety with action. So when the news feels overwhelming, taking at least one constructive step that can restore a sense of agency. And that's a challenge I'll leave with you in the next slide, I believe. But it could be something like joining an advocacy effort, uh, contacting a decision maker. You've heard things like this from us before, but in a different context, right? Sharing accurate information. So if you see a lot of people sharing misinformation, you can share the accurate information. It's not going to hurt anything unless it does. Supporting a related cause. Maybe you can't fix something that's going on across the world, but maybe there's something that's more in proximity to you that's related, and you could feel like you're a part of the solution instead of just bemoaning the problem. Helping the community prepare, um, and focusing on the next useful action. We can always do those things. All of those things are free, and that's what I love. Most of the things that can build resiliency in us are completely free, or what I like to say, free 99. So that's a price that we can pay. Um, this is what I would encourage, and Dr. Trinidad, please add to this or take away from it anything that you think is appropriate. But I encourage you, if anything piqued your interest, or if you heard some of these things and you're like, yeah, that's definitely me, I would recommend that sometime this week or this weekend, since we're going into the weekend, that you set some news boundaries. Like we discussed before, maybe practice some mindfulness, whether it's just taking a walk, or the exercise, or whatever helps you cope. Like I said, you Google these things, you're going to find everything you need, right? And then connect and take action, whether it's talking with a peer, that's pretty low bar, or taking a constructive advocacy or community action, or reconnecting with one of the reasons that this work matters. But either way, just make it small, make it specific and realistic, and your nervous system will love you from it. This is just to sum up. News-related stress is normal during periods of rapid change and uncertainty, which I might think we might be in one of those situations. Public health and social service professionals feel this stress more deeply due to direct connections to the communities and the funding that we're working with. Chronic news stress can show up emotionally, cognitively, physically, and behaviorally. So just being on the lookout for those signs. Staying informed without becoming overwhelmed by setting boundaries, choosing reliable sources, and taking up intentional breaks. And then I said that in the last slide. And I just want to personally thank you all. I say this often, but it's because it's truly in my heart. It really does matter to me that the people that I work with care about their communities, that they're driven by the same things that drive me, which is, we believe that things should be better for people. And so we work really hard to make sure that if there are terrible things happening to people, that maybe less terrible things happen, or maybe even good things happen. Um, Keep on being yourselves. Thank you for being yourselves. And that's partially why a lot of these things will impact us more than other people, because we're built that way. We care that way. Lean into it, but lean into it with the strategic know-how that you can protect yourself from some of the some of the negative things that come with having that big heart that drives you. So that's all I've got today.
Could
We've
I
got,
add something?
Absolutely, please.
I was thinking, you know, as a take home with this, make sure that you have a supportive team, a social or even at work that, that you can meet and debrief about situations that you're experiencing, particularly negative one, and that you guys are supported. I don't know if I share this, but I lived in Utah for 9 years. Did a lot of mental health work over there, and that community showed me a great deal of how we have to support ourselves, be there for ourselves, for each other as well. And how do we do that so that we can move forward and help our community stay healthy? And every time that I find challenges and I'm experiencing some type of negative uh, um, thoughts or stress or whatever, I think about when I was living in Salt Lake City with the team that I had. Again, there's a lot of differences, but we all tend to have the same common ground. And that's what we have to, really reach out to the support system. And if we don't, we have to also be alert of how people's behavior changes so that we could say, hey, I'm contacting you because I noticed that you're not, as social as you were last week. Is there
Mhm.
anything I can help you with? We just have to be more aware of ourselves. And if we're experiencing these situations ourselves, imagine how many other people in our social circle are also experiencing with the time that we're living right now. It's very stressful. But thank
Absolutely.
you. Yeah.
Go for it, Jonathan.
Is that the new Red Bull, Joseph?
Oh, this? No, it's sparkling
Oh,
water. One of my addictions, sparkling water.
oh, okay. I was
The,
just wondering.
if it was the new Red Bull, I'd be talking a lot faster.
No, I just wanted to chime in because, I mean, everybody's right. There's a lot of negative, there's a lot of things that you have to look out for, but I tell people I'm more of like an in-person type kind where I hear the stories and I like to look at the good of things because, like this past weekend, we had the fire. I don't know if a lot of you saw that we had a fire behind our casino on Santa Clara Pueblo, and everybody was like, well, like everybody okay, and and this, but my brother was actually the incident commander for a certain shift for the fire, and he was actually the one that helped that gentleman out of his trailer home to take him to the hospital, and at the end of the day he's like, the valley's still my home, Espanola Valley, and either whether Santa Clara, Espanola, or the Santa Fe County, or it doesn't matter. He's like, I still have a duty to protect anybody, and those are the stories that don't get out, and with me, it's like I like to hear those, and those are the ones that make me feel good because everybody sees the fire and the damage, and there's a lot of negative going on about the homeless or like how this and that, the methamphetamine in Espanola, but it's like these are the stories that like I like to hear and I like to capture because it's like, but he's not the go out to the press type kind of guy. He's like, no, he's like, I'm just doing my job, but those are the things that I love to hear. And that's why I like to just talk with amongst my local people because there are a lot of good things in Espanola that are happening, and a lot of good things in the county and on the reservation. And people are like, well, he was from Santa Clara. And I said, yeah. And so he's my brother. And they're like, oh, wow. And people don't recognize that a lot, that there are a lot of good helpers, good people out there, and people just don't know 'em, and it's just like because they just do their job. They just go out there and do it. And the news kind of like just goes up off the bat and kind of like turns into, oh, maybe it was this, maybe it was that. I was like, no, it's like my brother was like, no, we just did this and that was it. I'm like, okay, plain and simple. So I just wanted to share that because that was kind of close to me with my brother, helping that gentleman out, getting out of the fire and, was able to save his trailer home, so it's like, those are the the feel good stories I like to share, especially because it's like, it's not on the news, but it's something that like the Valley of Espanola needs to hear.
Thank you so much. And thank you for giving me an extra smile today. I needed that one. Yeah, awesome. Um, well, just to close out real quick, also I normally like to have a Google sheet with all of the links for you. I just did not have time to get that done today, so I do apologize. But if you Google those words, you're going to find all of those things. And if you need help finding that, let me know. Always, our team is here to serve you. Please reach out if there's anything you need. Um, also, remember our next Health Council talk will be May 15th, where we will hear from Hole in the Heart, promoting awareness of congenital health defects with Tamara Shannon and Sandra Sanchez. So, I'm not going to try to say that. I'm going to mispronounce it. So, yeah, thank you so much. Let's see. I never have a problem with ending early, but I do recognize that Valeria is on the call, so I just wanted to double check to see if she had anything to say. And I'll just let you close out, Valeria.
Yeah, thank you, team. I'm so appreciating this Health Council talks, Joseph. Everybody's navigating a lot. And to Joseph's point, the Alliance is here with you and for you in a variety of capacities that meet your needs. And we're in this together, my friends, and take good care of yourselves and each other, as Jonathan mentioned. We're so grateful for all of you. Thank you. Have a nourishing weekend. Thank you, Joseph. Thank you,
Bye, everyone.
everybody.
Thank
Thank you, everybody.
you.
Have a good weekend.
You too.
Thank you, Dr. Trinidad.
Thank you. Take care.